Hi, it's Kevin, and this week's learning is the third video in the series assessing GTPS. So we've already looked at the assessment and the risk factors for GTPS, and the second video we also looked at the educational component that makes up a key part of our treatment. The third video is all about the adjuncts for GTPS. So these include steroid injections, dry needling, PRP injections, shockwave treatment, and hormone treatment. So just as we go forward, the evidence in this presentation is where possible based on the highest quality of evidence, so systematic reviews with meta-analysis. So where I have those available, I have not included narrative reviews or other reviews that do not use statistical analysis. Where none of these are available, then we've used the RCTs wherever available. So the first part is, do steroid injections help improve GTPS pain and function in patients? So we're going to look very briefly at, first of all, steroid injections versus wait and see or no treatment, then steroid injections versus dry needling, and steroid injections versus placebo. So comparing steroid injections to wait and see or no treatment. So against no treatment, there was no significant difference in pain scores between steroid injections and no treatment. Comparing to wait and see, while steroid injections did improve pain and global rate of change short term, these changes decreased and were not significant and did not meet MCID from 8 weeks after for pain and 12 weeks after for global rate of change. Comparing steroid injections to dry needling, there was no significant difference between dry needling and steroid injections for the improvement in pain. And comparing to placebo, so saline, again, there was no significant difference between steroid and saline injections, and actually in some cases the placebo injections were better. So in conclusion, steroid injections do not provide long-term improvements in GTPS pain and function. There appears to be no significant difference in MCID, so the minimal clinical important difference, with steroid compared to dry needling, placebo, or wait and see. So in my opinion, steroid injections do not have a role in the treatment of GTPS. Other injections include PRP. So we're looking here and we're comparing PRP versus steroid, PRP versus placebo, PRP versus no treatment. So if we're comparing it to steroid, PRP does show significant improvement in patients with GTPS when comparing them to steroid. There was no separate group to see if the patients would be getting better, so with controls. So we could do with PRP versus steroid versus wait and see. The other study, so PRP injections versus placebo, you can see here that at 3 months, PRP did get the minimal clinical important difference, but there was no significant difference to placebo. And at all other time points, there was no difference between PRP and placebo for the improvement in pain or function. And comparing to no treatment, so compared to no treatment, PRP injections did not produce any significant improvements in function. PRP did produce short-term improvement in pain, but 6 to 12 months after, these were non-significant. So in conclusion, PRP showed a significantly greater achievement in the MHHS outcome measure when compared to steroid. There is also short-term improvement, 1 to 3 months in pain VAS compared to no treatment. However, PRP injections do not appear to provide long-term improvements in GTPS pain and function, and in some cases are no different to placebo. Next, we look at dry needling, and we look at dry needling versus steroid injections versus dry needling with loading versus usual care, and dry needling versus PRP injections. So versus steroid injection, as we've said previously, there's no statistical difference between dry needling and steroid injection for the measurement of pain. Dry needling plus loading did improve significantly in pain and the other outcome measures in favor of dry needling and loading. And versus PRP injections, both groups achieved the MCID of the outcome measure at 6 and 12 months, although the PRP did score better in the outcome measure for sport. Both groups met the MCID values for VAS. There was no significant difference between rate of MCID achievement between groups for pain or other outcome measures. So in conclusion, apart from that part looking at sport, dry needling appears to provide significant improvements in pain and function in GTPS, similar in some cases to those by steroids and PRP injections. And adding dry needling to loading can create even more improvement. The next one is a brief look on Shockwave and looking at systematic reviews with meta-analysis by Rim and colleagues in 24, Gazendam and colleagues in 2022, and Hardin and colleagues 2024. While the first two studies did not show they showed non-significant improvements in pain and function. The review by Hardin, which was a better review, suggests shockwave therapy appears to offer marked improvement in pain and function, which is still present after a year. So in conclusion, in my opinion, shockwave appears to be a valid option, providing long-term improvements at 1 year. And the final one is the use of hormone treatment. So the study here was a controlled trial, and they basically looked at hormone cream, and they basically looked at the score on VISA-G, and they stratified them according to BMI. And what they did find was that hormone cream consistently improved VAS scores across all BMI groups compared to placebo, with the strongest and most reliable effects in patients with BMI of below 25 and greater than 30. So in conclusion, hormone treatment appears to be associated with improvements in some patient outcome measures in GTPS patients. So in conclusion, there is evidence that some treatment adjuncts are more beneficial than others in the management of GTPS symptoms. If the patient is not improving with our standard first-line exercises, education, load management, and comorbidity management, the following could be tried if indicated, although not in order: dry needling, shockwave, hormonal treatment where those patients would be appropriate, although there is still lots of literature and research to be done on this. In my opinion, PRP and steroid doesn't have that much of a role in our treatments moving forward. I hope you've enjoyed this video, and if you have, please like, and we'll see you next time.